is the broad picture of trying to bring into light the idea that we work together as a community to try to create a broad sense of people living as healthy and as prosperous of life as they can. And so public health is so all-encompassing for so many programs. You almost all around you, and almost everything we do is related to public health, whether you're fixing roads and streets, or whether you're providing home care services, or whether you're providing environmental health inspections, whether you are serving public safety as a police officer or a fireman. That's all relevant to providing a safe and healthy environment for people to live. Environmental health is really about the situation that we all live in. Each of our lives involves a different environment. Whether you're at a different work environment, whether you're home, each of our homes are different. Our car environments are different. And so environmental health is looking at the person as a whole, individually, and recognizing that their environmental health situations are different, unique, but then in some respects they're also similar. And so we look at groundwater supplies, we look at sewage treatment, we look at the food that we eat, we look at the recreation that we utilize, and of course we look at the homes that we live in. And so environmental health is such a broad sense of who we are individually and how that plays into our overall public health. We offer a wide variety of different services to include food service assessments. We inspect restaurants, hotels and motels, a whole broad scope of temporary food events, mobile food units, so on and so forth. We do tanning bed inspections, we do septic system inspections, we do tattoo parlor inspections, we do swimming pool and spa inspections. We also do a lot of permitting services for water wells and septic systems. We do a healthy homes program where we go in and assess people's living environments and try to help make sure that a person's indoor environment, especially with kids 0 to 6, but even people who don't have kids, assess home living conditions. We do nuisance investigations, and we also do vector control. So we go out and do mosquito assessments throughout the summer to assess the kinds of mosquitoes, depending on the seasonal amount of rain that we receive, monitor whether or not we're seeing increases in numbers of mosquitoes, and then types of mosquitoes, and that helps us do some surveillance for specific types of illnesses that mosquitoes may be carrying. We also deal with various calls related to bugs, bed bugs, cockroaches, and that sort of thing. Moisture, mildew in homes. Of course, right now we're dealing pretty much across the state with some flood response. So a lot of times we provide consultation services for people in their living environments or even in their work environments where maybe they have some moisture issues that they need to deal with or outright flooding. And then we also deal with rabies control. Oftentimes we submit bats for rabies analysis. Sometimes we're dealing with animal bites that might occur. So we do a broad array of different programs, and so oftentimes most people don't recognize all the services we provide. So we always want to stress to people, check out our website because you might learn something. Well, people want safe water to drink, to recreate in. They want to make sure that, waste treatment for sewage, especially in the rural areas, is handled appropriately. People want to swim in safe recreational waters, swimming pools and spas. People want to make sure that they have safe food to eat. And so environmental health is, again, it's so broad and yet individualistic in the sense that we live in our own little bubble, our own little world. And so we're out there trying to help people achieve a sense of public health, their own individual health, through the services that we provide.